us.
But first, hopeful news in the fight against COVID-19 right here in Arizona. State health officials reporting a sharp decrease in new COVID-19 cases after that Omicron surge.
More than 2,100 new cases were reported today. Arizona hit a record high numbers in January. Whitney Clark is joining us now to explain what's going on in hospitals.
Hey, Jamie and Yetta. So according to data from the Arizona Department of Health Services, roughly 443 ICU beds were in use by COVID patients today, which is actually the lowest it's been since last October. This apparent downturn happening during what's typically a busy time for hospitals.
So our highest peak was towards the middle of January.
Dr. Michael White is the chief medical officer for Valleywise Health. He says now hospitalizations are about half of last month's peak. While they are blessed to see a decrease in COVID-19 patients, winter is always a busy time in our hospitals with an influx of seasonal visitors in our state. Dr. White anticipates a decline in COVID cases over the next few weeks. But if this pandemic has taught us anything, he says it's to be prepared for the ever-changing virus and its variants. The pandemic and its peaks have been incredibly trying and tiring for our healthcare workers.
These people haven't faltered. They haven't been able to work from home. They've been coming in every day to make sure that we're able to care for those that truly need this, have access to do that, start to learn new and better ways to get us through the pandemic.
On a national level, officials were asked in a briefing today if the White House is planning on bringing the country out of the pandemic and what that would look like.
The president, as I just mentioned, has been clear that we're moving toward a time when COVID won't disrupt our daily lives, a time when COVID won't be a constant crisis. So we're no longer fearing lockdowns and shutdowns, but getting back to safely doing what we all love.
While cases appear to be decreasing on a daily basis, Dr. White says COVID-19 is, of course, still circulating in our community, and he urges people to take all of those precautions we've been talking about for so long now, including getting vaccinated to avoid getting really sick and winding up in the hospital. He says COVID-19 will be in our healthcare systems for a long time, but they want to avoid big spikes and get to a manageable level so the virus doesn't overload hospitals. Yetta?